We have included 71 eyes, cataract eyes in this study, where we either implanted a toric monofocal lens, the Ankoris, or a trifocal toric lens, the Finevision toric. We have followed these patients for a period of 12 months, and we examined the patients as early as a couple of minutes post-surgery up to these 12 months, and we followed the rotational stability of the lenses. The key findings of that study were that actually this new double C-loop design is very stable. After 12 months we had 3.4 degrees of rotation, which is excellent. A second interesting finding of the study was that although the design for both lenses was identical, the multifocal version of the lens was somewhat more stable, rotationally stable, than the monofocal. So there must be something with the surface treatment, because the surface of the multifocal lens is different than the surface of the monofocal lens. There was a significant difference in rotational stability between the multifocal and the monofocal lens. As with any toric or multifocal toric lens, in a number of cases you might be confronted with, for example, too high of a rotation post-surgery. And we had, I think, in one of the 71 eyes, we needed to go into the operating theater again 1 week after, because we had a rotation of more than 10 degrees, which was significant for the patient. And in two patients in the multifocal group, we had a residual spherical error of more than 0.75, and there we have implanted a piggyback lens to correct the residual spherical error. The most important factor is the selection of the patient and the discussion with the patient. As we discussed before, especially for multifocal lenses, there is a lot of contraindications. So in general, for a multifocal lens to be of benefit to the patient, the eye should be healthy. There should be nothing that would theoretically interfere with a 20/20 vision. For example, macular problems, corneal dystrophies, corneal scars, all these conditions should be excluded. And second, there is the discussion with the patient, also very important in the context of multifocal lenses, because as we discussed before, there are some minor disadvantages, and the patient should be very well informed and aware of the potential disadvantages. Finally, it's the patient who will make the decision. So that's the first key success factor. The second most important success factor is the adequate preoperative measurement. You should be able to have several measurements of the cornea, for example. There must be a high degree of correlation between the several measurements you do, and your devices should be able also to evaluate the posterior astigmatism, which can have a major influence on the total astigmatism of the patient, and not every device is able to measure the posterior astigmatism. The third success factor is surgery. The surgery must be done with a lot of care. The rhexis must be well centered. The rhexis must be of perfect shape and size. in order to prevent decentration or asymmetrical shrinkage of the capsular bag post-surgery. You need to polish a little bit more than with the normal lens in order for the patient to benefit really from your toric or multifocal toric lens. I insert the capsular tension ring in each of the eyes where I will implant a premium lens, because I think with the capsular tension ring the fibrosis and the capsular shrinkage will be a little bit more symmetrical, and therefore the lens will be less prone to decentration or to tilting.